I want to be a great surgeon. Like Mr. Crossland. He's a genius.
Good to meet you.
And you. I've heard a lot about you from Mr. Crossland.
Really? We've only just met.
Oh, I've had my eye on you for quite some time.
Daniel, I told you, don't trust Crossland.
I don't.
And Daniel agreed to this.
Apparently he was only too happy to help. I just met him last night. He seems like a nice guy.
Yes, he is.
Ibuprofen could kill her.
She never mentioned an ulcer bleed.
She did. You weren't listening. Or reading the notes. You were too busy being nervous.
His behaviour has made it almost impossible for me to allow him to remain on the course.
Well, I wouldn't be here if I didn't believe he'd make a good doctor.
It's going to be all right. Well, it's going to be okay. I'll be the first to admit the first day was tough. Tougher than I expected. But I was determined to make it work. I thought I could do it. I didn't want to let anything stop me from becoming a surgeon.
But at what cost, Michael?
Morning.
Oh, sorry, I was miles away. What are you doing here? I thought it was your day off.
Yeah, it is. I just thought I'd come in and check my assessment over one more time ahead of tomorrow.
I'm sure you'll be fine.
I'm not. I was up half the night worrying about it.
Morning, Simon.
Jimmy?
Did you want something?
Nah, I can wait.
You sure I can't help?
Yeah, it's fine.
For heaven's sake. Here.
Right, where'd you,
In the bathroom.
Great.
Under these.
What's in there?
Underpants.
Yeah, I was wondering where they got to. Better get back.
What?
I'm not going to have sex with him till at least date 3.
Who says we had sex?
I do, and half the neighbours.
I'm not embarrassed. It was great.
So I gather.
What's this all about, Peter?
About? Oh, just breakfast. Conversation. You know.
I know you look down on my decision to go into general practice. Your recent silence speaks volumes, and now out of the blue you want to meet me. Well, if you're going to apologize, I'm here, and I'm listening. Or do you have something else on your mind?
The advances that we have made in the past year have...
Something I did a long time ago has come back to haunt me in a way I never thought possible. I'm involved with something, and I don't know what to do about it.
I see. Can you tell me what it is?
I don't believe I can.
Well, then I don't think I can help.
Oh, Hester, please.
What I don't understand is why me? I mean, you know I'm not going to tickle your tummy and forgive you like everyone else does.
That's why.
Have you spoken to Amy?
It would destroy her. And our marriage.
I see. Well, I think I can make an educated guess.
You don't understand.
Well, you're right. I don't, but I know what your reputation is, as does your wife.
It's not just that. This could mean my career.
Then you have to stop it.
It's not as simple as that.
Yes, it is. The rest is self-indulgent. Carry on and face the consequences, or make a clean break and stop hurting people. That's all I've got to say.
Thank you, Hester.
And for what it's worth, there's nothing you can say to Amy she doesn't already know. Well, thanks for breakfast. I have to go. We didn't quite get to the apology. Can't say I'm surprised.
Michael.
Why didn't you pick up before?
I was in a meeting.
Can you call them? I told you I needed it today.
Michael. I'm sorry. The deal's off.
No, it isn't. You know what I'll do.
Then do it. I've had enough of this. This isn't helping you, and it's destroying me. Tell whoever you want.
No, not now. Not today. Please, just give me one more day.
No.
Michael.
Ruth! Hi. Hi.
Are you okay? You look a bit...
I'm fine. Not at work.
I'm on my way there now. I'm just collecting these for Julia.
Right.
Are you coming? Daniel's probably sending out a search party.
I'll meet you there. Could you... sorry to ask, but could you cover for me? I told Daniel my car had broken down.
What's going on, Michael?
There's something I need to sort out, that's all. It's personal. I'd really appreciate it if you didn't tell Daniel you saw me here.
On one condition. Take me out for that drink later.
Promise.
All right.
Thanks, Ruth. You're a star. I'll be right behind you.
See you later then.
Can you please make an exception? He usually signs for it, and I always pick it up.
I'm sorry, I can't do it.
Lucky we don't have any patients waiting.
Sorry.
It's all right, Michael's late as well. His car wouldn't start.
Yes, I know. He rang me too. He's right behind me.
I know you're lying, Ruth.
What?
Well, you just had breakfast with him, haven't you? Last night, back to his. Barry White, a little bit of vino.
You are so full of
Really sorry about that. So annoying.
Oh, what was wrong with it?
Flat battery. Left the lights on.
OK, well, now you're here. Let's make a start.
Absolutely. I'll just pop to the loo.
Goes to the loo a lot, doesn't he? We've been feeding him.
It's just the odd thing, but I'm starting to get concerned.
Of course. What kind of thing are you noticing?
Oh, just stupid little things, really. I'm knocking stuff over a lot. More than I used to, anyway. Losing my appetite. And I can't seem to concentrate on anything for more than 5 minutes.
I see. Right.
I've been taking that St. John's wort, but I'm not sure it's helping.
Have you been getting any mood swings? Feeling angry or excited for no reason?
Yeah, I have, now you mention it.
And how long's this been going on?
Oh, 6 months or so. I didn't come before because, well, I'm not a big fan of doctors, if I'm honest.
Michael, you OK?
Yes, fine. No problem.
You look like you need a doctor yourself, son.
You've had these symptoms for 6 months, and it's only just occurred to you that maybe you should see a medical professional.
Hold on.
Well, I didn't want to believe that there was anything wrong with me, that's all. My grandfather had something called Huntington's disease. I was afraid
I don't believe it. You had a family history of Huntington's, and still you put off seeing a doctor.
I was scared.
This is absolutely not the...
All the more reason to come. It's degenerative, and now, because you left it so late, the treatment isn't going to have any impact.
All right, that's it. You're out of line, Michael.
You're going to be dependent on others for the most basic tasks. You won't be able to work or live anything like a normal life, and all because you didn't listen to what your body was telling you and get yourself to a doctor. What kind of idiot are you?
I cannot apologise enough.
I've never been spoken to like that in all my life.
Like I say, he's a medical student. He's been under a lot of stress. If you'd like to reschedule...
That's on you, Nelly. I'll be going elsewhere in future, thank you. Absolutely outrageous.
Still need to talk. Sorry about that. That was a misunderstanding.
It's all right.
What the hell was that? You simply cannot talk to patients like that.
I made a mistake.
It's completely unacceptable. Be a miracle if he doesn't complain.
I just lost it. Huntington's so huge, and he was so blasé about
All
it.
the more reason for you to use skill and compassion.
It won't happen again.
And what is this with you phasing out in the middle of consults? What are you on, drugs?
No.
What is it, uppers, downers?
I'm clean, honestly. Please, Daniel. I'll get it together.
Do you know what? I've had enough. I want you out. Right now.
I can do this. Just give me another chance.
I've given you plenty of chances. You're more interested in yourself and your career than you are in the health of your patients. Get out of here and have a think about your priorities.
I understand what you're saying, and you're absolutely right. But it really won't happen again. And I'm sure Mr. Crossland would really appreciate it if you helped me out.
How dumb do you think I am?
I don't.
Then why are you spinning me this Crossland line like it's suddenly going to change my mind? You know what? As far as I'm concerned, I've scratched his back enough. Now, this is my consulting room, and you're not fit to be in it. Mr. Cronin, if you'd like to come through.
Daniel.
What happened? Michael.
I just lost it with a patient. It was a mistake. Maybe you could speak to Daniel, persuade him to change his mind.
I can't persuade Daniel to do anything.
Please, Ruth, I just need to get through these 2 days.
Why? What's so important about these 2 days?
I can't explain. I'm sorry.
You have to start telling the truth or I can't help you. Now, what is really going on?
I can't. I just can't.
Give me a minute. Stay where you are. Campus surgery.
Ruth, it's Julia. I need that PowerPoint presentation today.
I'm a bit snowed under here, Julia. Can I...
No! I need it now. Get it over here as quickly as possible.
Okay.
You willfully concealed your condition. You stole prescriptions. You forged the signature of a senior surgical consultant. I understand your explanation for your actions, but I'm afraid it does not excuse them.
I know what I did was wrong, but I was desperate. Medicine is my life. Wouldn't you risk everything if you were me?
What is it with Crossland?
He hates me, hates the mill, hates GPs. He's like a lot of surgeons, he's power crazed. He's like that with women as well. Why his wife Amy hasn't left him is one of life's great mysteries, and she's a really nice lady. The tales about his affairs would make your hair curl, promise you. Nurses, secretaries, his PA.
Did you ever?
Touched him wearing a pair of rubber gloves and didn't stop him trying, though. Is it working?
No. It's something to do with software. Is there any way that you can manage without this?
Ruth! I have based my whole presentation on this PowerPoint. Now, you have had ages to do this. I mean, why have you left it to the last minute?
Well, I've had all the work to do.
Oh, for goodness sake, I haven't got time for this. Just go. Leave me alone. Go on, leave. I wish I'd never asked you.
I need to tell you something about Michael.
Oh, don't start. Okay, I gave him more than enough chances.
It's not that. There was nothing wrong with his car this morning. I saw him near the pharmacy at St Phil's and he asked me to cover for him. He seemed really stressed and was acting strange.
So he's a liar on top of everything else.
Hold on, let me finish. Yesterday at lunch, he zoned out completely. His face froze like a mask. He stiffened up. He ran to the toilet and he never came back.
Yeah, he did that a couple of times with patients. He's on something. Uppers, downers, I've seen it before.
What actually happened with that last patient?
Well, the old guy left it a bit late coming to tell me he developed Huntington's symptoms, and Wonder Boy starts tearing a strip out of him.
What kind of symptoms? Please, Daniel.
Well, typical early stage stuff. Zoning out, concentration problems, mood swings, involuntary movement. And then he walked out. It's not Huntington's. I mean, the shake is probably a reaction to whatever drugs he's taking.
I can't believe he'd do that. The way he talks about surgery and what it means to him, why would he jeopardise that just to get high?
You don't understand addiction. Nothing matters as much as the fix.
Well, drugs. Oh, Huntington's, he needs help. So.
I hope he gets it.
You're all heart, you know that? I'm going to find him.
What's this? Starsky and Hutch?
Michael?
Michael?
Michael? Are you in there?
Ruth?
Michael, it's Daniel. Can you let me in?
You'll have to let me in. Michael? Michael? Michael, what's wrong? What is it?
You can take him. Mr. Doper. I'm not even licensed here yet.
What is it?
It's Parkinson's, right, Michael? Where'd you get the drug? Who's your specialist?
I stole prescription pads. Self-medicating.
Need to get him some pills. Okay.
How's the patient?
Stable. Tell me you didn't know anything about this.
I was as in the dark as you are. I always thought of him as a model student. And now to learn that he acted so unethically. Stealing prescriptions.
You know I'm going to have to report this to the university. There goes his career as a neurosurgeon.
That boat sailed the moment he found out he had Parkinson's. Absolute tragedy. Daniel, I really am very grateful.
Save it. Yeah, I don't know what's going on here. But a medical student doesn't get hold of trial drugs on their own, no matter how gifted he is. So you got me to scratch your back. Well done. Hope it was worth it.
I don't believe we've met. I'm Peter Crossland, consultant neurosurgeon.
I'm Ruth Pierce, receptionist at the campus. Heard a lot about you from Michael.
All of it good, I hope?
Absolutely, he worships you.
I get a lot of that from students. Undeserved, I assure you. Well, if you'll excuse me.
I wonder if you could help me, Mr. Crossland. There's something that I don't quite understand.
I'll do my best.
If Michael thinks so highly of you, why did he fake your signatures on the prescriptions? Surely that would jeopardise your career as well as his.
Perhaps. I really can't say. People do irrational things.
They do, don't they? Maybe I should check with the pharmacy. They'd be able to tell if the signature was a fake, wouldn't they?
That won't be necessary, Miss Pierce. I signed them. All of them.
Why?
I can't tell you.
I understand. I will tell what I know to the GMC and I'm sure they'll be in touch with you.
Miss Pierce, please. He's my son. His mother was my PA many years ago. I was already married. I didn't even know he existed until he came to me and told me that he had Parkinson's. But he still insisted that he wanted to be a surgeon.
You knew that he couldn't be?
I thought it better that he find that out for himself. I'm just sorry that it came to this.
Why did you agree to give him the Nestodopa?
I didn't exactly agree. He left me little choice.
He threatened to tell your wife? You could still help him. You could tell the truth. That he didn't forge the signature.
I can't.
You can't let him take all the blame. He's still got a chance of a career. Not as a surgeon, maybe, but as a GP.
That's doubtful. And, this could spell the end of my career. And think of all those lives that I could save. Gone. Now, it's a travesty what happened to Michael, but there's no sense in dragging me down with him. Is there?
If I could get through at least 2 days, if I could keep the symptoms under control in front of you, then maybe I could still be a surgeon. I know it sounds stupid now, but I had to try. I couldn't let the disease win.
Picked the wrong battle, mate.
I can still be a GP, though. Like you, I've really loved these last 2 days.
You're delusional. They'll suspend you the second they find out.
Not if you keep it to yourself.
Nice try. I think I've been played enough for one day. Speak of the devil.
I'd like to speak to Michael alone, if you don't mind.
Go on, say it. I told you so.
You must have known you couldn't hide the symptoms forever, no matter what wonder drug you took. Did you exceed the dose?
This is the only thing I've ever been good at. And it's what you do.
I understand you're not going to tell the truth about where you got the drugs from.
Why take you down with me? It's not your fault. I forced you to do it, and besides, I don't want to ruin your life.
No, you haven't. There's no way you could.
Yes, there is.
I can't tell Amy. You know that.
Oh, Ruth. Sorry about all this. I was just telling Mr. Crossland, he was just running me through my options.
Stop it, Michael. She knows. Everything.
I wish I didn't.
Join the club.
I wanted to give you this. I think it's your decision.
I've already made it.
I'll do what I can to see that Professor Morrison looks at your case sympathetically.
Are you okay?
I'm fine. Everything's fine. I'm sorry I lied to you, though.
I understand. Not sure Daniel does.
Has he told Professor Morrison yet?
No, too busy kicking himself for not realising it sooner. So what are you going to do now?
I hope Morrison will consider me becoming a GP, but...
Well, I will support you however I can. Right?
Well, I've taken everything you've both told me into account, and whilst it's clear that Michael was acting under stress, to forge prescriptions and self-medicate with an unlicensed drug is simply unacceptable. You put patients' lives at risk. You broke the bond of trust between patient and doctor. I have no option but to expel you from the medical course here at Lethbridge University. And I wish you all the best for the future, but I'm afraid being a doctor of any kind is simply out of the question. So if you'll excuse me, I have a lecture to get to.
I don't understand why you're not telling them.
Come on.
It's all over.
You're too good to be a measly GP. You'd have hated it.
How do you know?
Because I would hate it.
So, what are you doing here?
I really don't know how to say it. I've told Amy. Everything. And she hasn't packed her bags. Yet. She has a few conditions. One of them was my early retirement, so that's happening. And the other... Well, it's my suggestion, actually. I know I've been a coward. Now, you're probably going to tell me to take a long walk off a short pier.
Whatever you're trying to say, just say it.
We could try to get to know each other.
What?
You and me. A bit late. I appreciate that.
Are you serious?
Never more so. Now seems to be the right time too, don't you think? We can talk about what to do next. What do you say?
You know, I'm not unsympathetic, but the guy did lie through his teeth for 2 days.
He had good reason. He deserves our support.
Yeah.
Daniel, they let you practice again after being put in remand. I think Michael could make a good GP. Maybe.
I'll think about it.
Ah, there you two are. Good day?
Not especially, no.
Just got off the phone to Mr. Crossland's. Quite a thing.
Yeah, could say that. Is Julia coming?
I suspect not. Focus on the presentation.
That's a relief. Do you want one?
Oh, very kind. Shiraz, please.
Coming up.
Well, Julia nearly took my head off this afternoon over a simple PowerPoint presentation. Thanks for dragging me into that one, by the way.
Oh, I'm sorry about that. I mean, it's not like her to be so stressed. She'll soon be back on the horse. I'm sure she'll be fine.
I would like to take you through our experiences of bringing a... I'd like to take you through our experiences of bringing...
My career is ruined, and you're correcting me.
It's not as bad as it seems.
Don?
What's this?
Well, if people won't listen to the truth, what can you do?
Well, you've got to do something. He's clearly ill.
Make him jealous.
He's very good at changing the subject.
Sexual Health Awareness